My name is Shira. I am a resident at Mount Sinai Hospital, and I'm going to be talking to you guys a little bit about asthma. So let's talk a little bit about what is asthma. So these here are kind of some cut up cross sections of the airways in your lungs. So we can see we have a normal airway here. It's nice and round, it's open. We can get our air in and out easily, have some nice easy breathing. Over here, we have an asthmatic airway. So what does that mean? It means the airway is tight, right? You can see this is representing inflammation. There's a lot of stuff in the airway. It's not open and nice. It's hard for the air to get in and out of the lungs properly. So what does that mean when you have asthma? What kind of things are you feeling? So some of the symptoms when you're having asthma, you might have wheezing. You might even be able to hear it yourself, that you can hear that wheezy noise when you try and breathe out because that air is trying to squeeze its way through the tight airways. You might have chest tightness because, again, your airways are so tight, you might even feel it in your chest. You might have shortness of breath because you're not able to move air in and out easily. You're not getting enough air to breathe, and you can feel that. And then you might also have cough. Some people even have asthma where that's their main symptom is cough. So I want to talk to you a little bit about developing asthma. So a lot of people who have asthma, they develop it in childhood, and there are some risk factors of things that make you more likely to develop asthma. So starting actually down here in this corner, there are unfortunately some genetic things, meaning, some things in our DNA that we can't really change that make us more likely to develop asthma. So some other things that are associated with asthma are other diseases like eczema. People who have eczema are more likely to have asthma. People who have siblings with asthma, right, it's kind of like already runs in the family. So those people are also more likely to have asthma. Then over on this side, we have this other disease called respiratory syncytial virus. It's also known as RSV. It's a lung disease that sometimes kids can get, and it can make them pretty sick. And there's some evidence that shows that kids who got RSV when they were little and got sick from it are more likely to get asthma. And then we go to the top. These are things that I don't want to say you can totally change because, some of it can be very difficult to change, but things that are more environmental. So over here we have tobacco smoke and other pollution, right? So if you grew up in a house where maybe your parents smoked or you were around a lot of secondhand smoke, that puts you at risk for asthma. And same with other pollution. So, if you live near a lot of bus depots, near the highway, all of that pollution that you're breathing into your lungs puts you at risk for developing asthma. And then on the other side, more things that we find maybe inside of our houses, but hopefully not. Things like dust mites, cockroaches can also put you at risk for developing asthma. So once you have asthma, hopefully it's well controlled all the time and you never have any difficulty breathing. But sometimes your asthma can flare up or be exacerbated, which means that you were doing fine and now all of a sudden you are having trouble breathing. So just like there are risk factors for developing asthma, there are also risk factors for having a flare of your asthma, which some of the things are the same and some of them are a little different. So what things are risk factors for flaring your asthma? So the first category is if you have any allergies. Like a lot of people have spring allergies to pollens, or in the fall, they're allergic to different weeds that you find in like moldy leaves. Your own allergies can make your asthma flare. So that's why a lot of people, their asthma flares during their allergy season. And then other things like dust and roaches and mold, things that a lot of people have allergies to, can trigger asthma flares. And then unfortunately, I know we all love our pets, but things like cats and dogs and other pets that shed a lot of fur can also cause asthma flares, which is why if you're ever talking to like a lung doctor or an allergist about asthma, they talk a lot about, keeping pets out of the bedrooms and having filters and a lot of other strategies for limiting the fur. And then finally, again, just like it can cause development of asthma, something that's really known to cause a flare of asthma are things like pollution and tobacco smoke. So again, then if you are smoking or you live with a smoker, that can flare your asthma. And if you live, near a bus depot or near the highway, and a lot of that smog is getting into your apartment or, on your daily walks or near your work, then again, unfortunately, that can cause your asthma to flare. So let's say that, something that I talked about feels like something really familiar to you, like you think, hey, maybe I have asthma, maybe my child has asthma. What do I do about this? So the first step is going to your primary care doctor. So if you're an adult, then you would see someone like me, an internal medicine doctor. And if you are worried about your child, then you would bring them to their pediatrician. And eventually you may even see a lung specialist, which is a pulmonologist. And the main way that asthma is diagnosed, the official gold standard diagnosis, is pulmonary function tests, where maybe you've even done them before. You blow into this tube, and sometimes it's like a little game where you're trying to blow out balloons or blow out a fire, and they see how well your lungs are functioning. And sometimes they even give you that test, and then they give you some pumps on this type of inhaler, and then they do it again, and they see how well you respond. And then your doctor will start you on some treatment for asthma, and they'll work with you to manage your symptoms, because luckily we have a lot of really good medications for asthma. And so if you start on a medicine and you're still having symptoms, we have more medicines. We have different types of medicines. So really, if it's something you're struggling with, I really hope that you go see your doctor, because, we want to keep people out of the hospital, out of the emergency department. It's something that we can take care of in the office and get you on really good medicines and get you very well controlled. It's sort of along the harm reduction pathway, right? Because
Sure.
we don't want to tell people to get rid of their pets, because that would be really sad. So we talk about things like trying to keep pets out of the bedroom, trying to limit things like curtains or excess pillows, things like fabrics that will hold on to pet dander. And then also having air filters is another layer of protection that you can have to kind of get that dander out if pets is a problem for you. Also if you have seasonal allergies, it can help with the pollen. Some are better than others, and unfortunately the really good, really effective ones can be more expensive.
Yeah.
The good thing is you only have to buy them once, but of course that's still an expensive one-time buy, but they can be effective in limiting allergens in your apartment or home.
Gotcha. Are there any special concerns for people who have asthma and vaccination?
Overall, if you have asthma, the general recommendation is to get all of your regular vaccines. There are a few vaccines that I believe you qualify for a bit earlier, like the pneumonia vaccine, because having a lung issue puts you more at risk. There's not any reason to avoid any vaccines because of having asthma, which I think is the biggest takeaway, is
Sure.
don't not get any vaccines because you have asthma. You should definitely get all of your vaccines.
From people's side effects and getting some symptoms from some vaccines, that typically doesn't have any association with really making asthma necessarily worse. But obviously having more of a cough or something like that from anything can feel like some of a exacerbation of your asthma. Generally, you definitely want to get those vaccines. Like Dr. Yellen said, it's really important to protect, especially if you have asthma, but then even to avoid developing asthma too, for your kids especially, and then even as adults, to get those vaccines to prevent any inflammation of your airway that can lead to asthma.
Is asthma a lifetime thing? Does it go into remission? I mean, I know you can treat it and keep yourself from having flare-ups, but is it something that once you have it for your life?
So a lot of people who are diagnosed with asthma as a kid do sort of grow out of it. They're treated as a kid, and then they find that as they get older, they're not really needing their medications anymore. They're not really having any symptoms. And so it's something that once you get diagnosed, it doesn't necessarily mean that you'll be on medications and having symptoms for life. It's something where, you can kind of work with your primary care doctor, and, a few years after your diagnosis, if you're saying, hey, I'm doing really well and not having any symptoms, then maybe you can slowly try reducing your medication and seeing if you're still really symptom free, and maybe you have outgrown your asthma, because a lot of adults who had asthma in childhood really don't have any issues as an adult.
And then in terms of asthma itself, there's such a range of how severe it can be versus mild. Some people just have asthma and they like need an inhaler like once a month, which is like a few times, or like if they are like doing a lot of heavy exercise or something. And then some people will need inhalers more frequently. And then there's different types of inhalers and different medications and pills also as it gets more severe, just to make sure that if you do have asthma or you're using an inhaler for any other reason, if you're using like albuterol, that's like a very common inhaler and was used for so long, that's really not as good anymore. That's something to talk to your doctor about. I mean, not that, and not anymore. It can cause relief, but it doesn't really treat what's happening. It's kind of just opens up your airways more, which feels good in the moment, but it doesn't necessarily help your asthma heal. So there's a better inhaler for that called like Symbicort, and there's a few others of a similar class, but that's a better one to use, even if you're using it like once a month or once every few weeks. I have a lot of patients that like use their inhaler every day and they haven't really told their doctor. That can be harmful, actually. So there's different types of inhalers, there's better inhalers, and sometimes even a pill medication to help your breathing. So when it comes to asthma, so just making sure you're aware of that and that you talk to your doctor. If you are using your inhaler every day, they need to know about that because you probably will benefit from a different inhaler and that can help you get better. It can really develop at any age. And one of the main things to remember is, especially for those living in East Harlem, this is especially a really, really high risk area for asthma. So we do see more adults develop asthma in this area and in Upper Manhattan and the Bronx compared to other boroughs. Like New York City rates of asthma are pretty bad just across the board compared to like the rest of the United States. So that's not to scare anybody. It is more to just be aware of that there is that risk. And even for adults, why it's important to get the vaccines to prevent it. And to be aware of some of your environmental, your housing, like just being a cognizant of like your house itself and calling 311 if you notice that there are any like pest issues or any other like filtration issues that you notice or that you're concerned about. Just call 311. They will like come for free to just evaluate and make sure your housing is at least safe.